This conference will now be recorded.
And over to you, Michael. Thanks.
Great. Thanks, Amir. Just checking everyone can hear me and see me clearly.
Yeah, all good. Thanks.
Great. So welcome, everyone. It's an absolute pleasure being here. It's fantastic to be able to present to you around evidence synthesis and different types of systematic reviews. I think it's an essential topic that just kind of sets that foundation for what we need to know around how to navigate this evidence ecosystem and these difficult decisions we have to make on a daily basis. Specifically now in this pandemic we see ourselves in and this infodemic. I just want to welcome everyone again. I see there's loads of people online. I would love to know where you're from. So if I can please request, please just type in the chat where you're from and where do you see yourself in the systematic review world. I'd love to get a bit of a background as I go through the presentation. Amir and others from Cochrane will monitor the chat, and so I would love to take questions during the presentation, and we'll see how we can incorporate those as we move forward. So Amir, thanks so much for the introductions, and I think without further ado, maybe just due course, I have some declarations and acknowledgements to state. Member of the South African Grade Network, also do some work for National on the essential drug list. And of course, special thanks to others who've contributed to these slides, who are part and parcel of the Masters in Clinical Epi program, which I help coordinate, and Tamara, who is a co-convener with me for the Systematic Review and Meta-Analysis module, which a lot of these slides is drawing from some of the experiences that we have in those modules. So it's great to be able to build on others and what others have done. And so maybe let's quickly go through what I'll be covering today. And it's three main things. The first is I would like to place us within the evidence synthesis kind of ecosystem. So where does systematic reviews fit into how we make evidence-informed decision making? And I think that's particularly important considering COVID, considering this infodemic we're kind of dealing with at the moment. And then secondly, we'll go through, why do we need the systematic review thing? What's the rationale around it? What are the risks if we don't go down that route when we make decisions or look at evidence to inform decisions? And then lastly, I want to give us an overview of the different types of evidence synthesis components or methods or designs that are out there. And I think share some key resources around how do we get started with one, answering questions, and secondly, getting started with conducting and doing a systematic review. And I think the best way to kind of tackle these three learning objectives is through an example. And before I get to that, I just want to welcome Fatima and others, Lynette, welcome. I see you guys are coming from all over the place. Some are doing their PhDs, some from Bloom. Great to see you all here. Welcome. So I'm going to start off with the story that's close to my heart. So I've got a daughter. She's now 3.5, close to 4 years old. But her name is Johanna. She's got beautiful curls. She looks like Goldilocks, but probably as naughty as well. And there was a time, when new parents, her first kid, and she developed kind of a really sore ear and eventually bilateral on both sides. And her mom, my wife, is an orthopedic surgeon. So she's like a bone surgeon, and I'm not sure how many of you are in the medical field, but essentially they're teased as being the dumbest of surgeons because they just deal with bones and they don't really care about the soft tissue, which in Joe's case included her ear. And I'm, not a real doctor. I have a PhD, she says, so I'm not a real doctor. So I can't really make these decisions in the family. And we didn't know what to do. Should we be giving antibiotics? What should we do? And my wife got various, advice from different people, from her doctor friends. And so we didn't really know whose advice to follow. And eventually it kind of got a bit bad, actually. That's her lying on the tiles because it's nice and cold and it's nice and she's, feverish. And Joe was getting sicker and we needed trustworthy evidence because this is about our daughter, things that are close to us, that we care about, like so many other healthcare decisions. And she turned to me, well, Michael, where do we go look for this evidence that's going to give us the answer, the best available evidence? And we kind of eventually, being in the field, we use the approach of evidence-based medicine to get to this best answer. And that really speaks to the rationale for systematic reviews and evidence synthesis. And you start to look at the EBM model, right? Where evidence is one component of how we make decisions. The others, as you would know, that's been said by Sackett and others in the BMJ publication right in the beginning of this whole, 2 decades ago, is a component of the best available evidence, together with clinical judgment and people's values and preferences. That merger in that Venn diagram, the bit in the middle, is evidence-based medicine. And that's what you try and get to most of the time. And there's loads of challenges in this model, including what we're facing today. But an important thing is we can't just rely on evidence to make decisions. I can't just rely on the evidence to make a decision about my daughter's health or what to give her. There are other important factors to consider too. Now, how does this EBM process look? What is the process that one has to go through to get to an answer? And it starts off with asking the right question. And whether you're doing a systematic review or deciding what kind of systematic review to do, which is coming down later in this lecture, that first step is the most essential step. If you don't have a clear and structured question, you're going to have a hard time getting the right evidence to answer your question. You're also going to have a really hard time, if you're conducting a systematic review, to find the answer that actually speaks to what you need. If you have a poor question, it's going to affect so many things downstream about you trying to find, use, or praise evidence. So we often use the PICO format to set questions, and I'm sure that would be dealt with in other lecture series from Cochrane and others. But it's really the most important part of any kind of evidence-based medicine journey, or in a journey, your own journey in doing and finding or developing systematic reviews. We then go to the second step, which is finding the evidence, the best available evidence to answer that question. We then move to appraising that evidence, which is essential because not all evidence is created equal. There are varying systematic errors and bias that can creep in, and we want to use and lean on the best available evidence with regards to internal validity. We then would apply that results. So for example, apply that to JoJo's setting, the best available evidence and the results thereof. And then we would see what the effect is and audit our process. And this model, this process is can be scaled to a global setting when it comes to making decisions, because this is essentially the model of how we make decisions. And when it comes to the evidence ecosystem, and this is from Magic app, the guys that are linking GIN, the Guidelines International Network, they've kind of given us quite a nice image about where systematic reviews fit into this ecosystem of making decisions. And you'll see there on the left, it starts with producing the evidence. So that's typically, researchers producing primary evidence, publishing trials, whether it be COVID trials on ivermectin, whatever the case may be, or in Johanna's case, trials around antibiotics for middle ear infection. The second step then would then to synthesize that evidence. And I'll talk a bit more about that later on, which eventually then, that synthesized evidence that gives a complete and holistic picture would then be used to develop a clinical practice guideline or a health technology assessment, or essentially a summary of that evidence that tells people what to do in a public health setting, right? And that's translated into a guideline. Then eventually that guideline as a vehicle would then be disseminated to policymakers, clinicians, and patients to use in clinical practice. And this could be done in various ways. So how that is implemented, how those guidelines implemented differs by region and process and question. But eventually that would then feed into a Q&A process and M&E, a monitoring and evaluation process. And that would then feed back into, well, what are the gaps that we need to produce new evidence? And the cycle would continue. And that's the evidence ecosystem, where evidence synthesis is the bedrock thereof. the absolute bedrock for starting this process. And so the question that we have is, well, who should we believe when it comes to doing evidence-based medicine? And in the previous slide, this all looks great and well, but there's actually so many challenges at each of these steps that impedes and makes it challenging for the clinician, the researcher, and the policymakers to access, implement, and use best available evidence, or at any of these steps in this ecosystem. And one of the first, I think, when one looks at systematic reviews, what are the challenges there? There are a couple of them, and I'll focus on that for now, because we can go on to many different lectures on all the other challenges. And one of the big questions one has to ask in the rationale, understanding the rationale of systematic reviews, is who should we believe? And here, this is a piece from Cochrane. It says, "Trust me, I'm an expert." And we can see this through so many things. You get these YouTube videos on, look at on diet. This is the latest best diet, and I'm an expert in diet. Look at my results. This is what you should be doing. Strong statements of effect, or doctors coming out about the effect of drugs like ivermectin. Who should we believe? And here's a classic example of a US pediatrician, Dr. Benjamin Spock, who advised people that prone sleeping positions for babies is helpful. But and he wrote, as you can see there, but in the end, it was found that it's exceptionally harmful and can cause death, sudden infant death syndrome. And so the question is really, who should we be believing? And there are many challenges in finding and using the best available evidence. And maybe just to ask people to mute their microphones. I'm getting some feedback. Thank you. So some of the key challenges that we face when it comes to evidence synthesis is things like information overload, where there is up to 75 randomized control trials published daily. And I mean, just within the pandemic, as we can see, there are thousands, if not hundreds of thousands of trials, and Amir can speak to this far better than I can. And it just creates an information overload. So people, how on earth are we ever meant to stay up to date? And that is a significant challenge, especially if so many trials are being published daily. And it's so easy to access trials in a sense, or get fed information preferentially about things that you're scanning on YouTube, for example. There's also this issue of anecdotal evidence. My neighbor got vaccinated, and or someone saying, but I know people who got vaccinated, and straight afterwards, a couple of days afterwards, they got very sick. Vaccination is causing people to get sick. Or other narratives, anecdotal evidence, things that aren't empirical and aren't studied in trials, causing confusion. These are significant problems that feed into the challenges that we find with evidence-based medicine. We also have these concepts of publication bias, that trials or studies that have better results often get published as opposed to those that don't. So studies that have positive results end up being in journals and being found, and those that don't have positive results tend to be in the grey literature and not being found. We also have, indexing bias. Different databases might have different availability of evidence or cover a different genre of evidence, and we might miss evidence if we only look at published reports. We have reporting bias, and this is where trial registries come in, and reducing research waste and making sure that in the trials that are being conducted, that people report what they said they were going to do, and that it's transparent, and they're not manipulating data. We also have issues around that some trials have and evidence has poor internal validity, in the sense that we need to be able to look at how close a study, how much we can trust a study really and its results. And there needs to be an assessment of a study's internal validity before we can move to essentially using it to inform decisions around health effects. And then lastly, I think file draw bias or cherry picking studies is a major issue, where, and you see this so often now on Facebook and others, where someone's saying, well, look at this study, it's fantastic, it shows that ivermectin works. But meanwhile, there are many other issues around that one needs to consider, like internal validity, like not looking at the entire picture or cherry picking studies that conform to your view. And so these are issues that we have to face, and that somehow a design has to be able to overcome. And this really is where evidence-based practice comes in, that we need to make decisions about healthcare based on the best available, current, valid, and relevant evidence. And this is where research synthesis comes in. And this, again, is a broad umbrella term that is talking about the process in which two or more research studies are assessed with the objective of summarizing the evidence relating to a particular question, or synthesizing it, putting it together. And the fundamental tenet here is that it is the best available evidence, so the evidence that is best suited to answer a particular research question that's being set. It's current, in other words, it's up to date. It's comprehensive. It's valid, so it has internal validity. It's able to answer the question, and relevant, so it speaks to the question. And there are many, issues with this. And often we find that social media drives a lot of the misinformation challenges that we face in these settings, in these conversations. So it needs to be up to date, it needs to be robust, and it needs to be relevant. It needs to be contextually appropriate evidence. So, what evidence to use? And here we can refer to the hierarchy of evidence, but typically we're taught, that trials are at the top of that pyramid, but really that pyramid is turned upside down depending on what kind of question you're asking. So if you're asking a question about the effectiveness of an intervention, like for example, in Joanna's case, where we're looking at whether giving an antibiotic or not, we'd want to look at randomized controlled trials. And that's where most of the methods have been kind of geared towards when it comes to systematic reviews. But there are many other type of questions that one might want to ask. What is the what are other prognostic questions? What is the effect of smoking compared to not smoking? What kind of diseases will I end up with? Test accuracy. How should we diagnose, do a rapid test for HIV, for example? Or questions around the prevalence of disease, like frequency. Or other questions around how do people feel about a particular intervention? So experiences and perceptions. These are all different kind of questions that would require a different type of study design to answer them. And that's the most important part here, is that the hierarchy isn't just with a randomized controlled trial on top. It's actually really dependent on the question that you're asking. So for prognostic studies, we'd want to look at cohort studies. For test accuracy studies or test accuracy questions, we'd want to look at diagnostic test accuracy studies or cross-sectional studies. And experiences and perceptions, we'd want to look at qualitative studies. But importantly, one of the founders of the Cochrane collaboration, Sir Ian Chambers, this is a quote from him saying, it's exceptionally important that results of a particular research study cannot be interpreted with any confidence unless they're being considered together with the results of other studies addressing the same or similar questions. And it speaks to this tenet that we can't just cherry pick single studies and use that to answer public health questions. We have to look at the cumulative evidence, all available evidence around that question to get a clear, robust, and comprehensive picture in order to answer the question that we've posed. So it needs to be research synthesis allows us to evaluate the results of a given study in context. And this is where, colleagues, the systematic review comes in. which is kind of defined quite well here. And again, to emphasize that it is a review in which bias has been reduced, so it has internal validity, by the systematic identification, appraisal, and synthesis, and if relevant, statistical pooling of all relevant studies on a specific topic, according to a predetermined, a priori, and explicit method. Again, this is about being systematic, as the word implies, having appraised available evidence and putting it together through whatever means. So that's how we would do it. We would want to use a systematic review. So let's quickly go into what are the key features of a review. Again, reviews set very clear objectives. They set a clear PICO. They have explicit and reproducible methodology. And this is very clearly outlined in the Cochrane handbook. And some of these kind of elements of reproducible methodology that comes forward in a review is the predetermined study eligibility criteria, where we have a particular question and we've set forward what studies we're going to be including so that we can't cherry pick studies based on their results. So these are set a priori as the type of studies that would best answer this clear set of objectives and questions. There's a comprehensive search for the best available evidence from both published and unpublished work. And then, of course, as per the definition was saying, an assessment of the internal validity of study findings, because the results of a systematic review are only as good as the studies that is part of it. So if there's junk inside your review, you can't place a lot of confidence in your effect estimates or your results. And then with appropriate quantitative or qualitative synthesis of the findings. So putting together the findings to answer your clinical question. And then, of course, beyond the methodology, there is a systematic and complete presentation of the results. And these are numerous, including describing what kind of studies you've excluded and why, the characteristics of included studies, and a transparent report of the internal validity, and how you eventually got to your judgments around the study results. So why are systematic reviews important? Well, it is a readable and reliable summary of all the evidence that answers a particular research, clinical question. It's also a really efficient way to access the body of research. So as a clinician or a policymaker, you don't have to go and find and search for all the trials around to answer a particular topic and put it all together. That's being done by the review itself. So it saves time for us to read individual studies. The summaries is already there in a review. They've already critically appraised the included studies for internal validity with an appropriate tool. And they've provided some kind of interpretation of results. They also explore differences between studies. So why are study results different and what may contribute to those? So that's really a useful element of a systematic review, that it can able to answer questions that individual studies on their own weren't able to answer. And of course, it's a reliable basis for decision making. It's an unbiased selection of relevant information if conducted well, and it's of course useful to healthcare policy, and it can advise on future research, gaps in and gaps in practice. It's transparent and it's up to date because of the a priori explicit methods. The up to date bit is interesting, and I think this is where the Cochrane systematic reviews and the Cochrane collaboration comes in, where you can conduct a systematic review as not part of the Cochrane collaboration, and there are reviews that you can of course do through the Cochrane collaboration. And when it comes to updating Cochrane, having reviews available that are regularly updated, this is one of the hallmark features of a Cochrane systematic review, is that Cochrane reviews are regularly updated, and each review includes a plain language summary, which is really useful for clinicians or not clinicians, lay people, who aren't scientists or clinicians. So, you know, I don't think I need to go on a lot about Cochrane considering the audience I'm talking to, but they are considered the gold standard when it comes to systematic reviews. And of course, there's exceptional guidance provided on how to conduct a review, outlined in the Cochrane Handbook. And I would say is the go-to evidence source for making public health decisions globally. So I would like to, you know, we've kind of given an overview of the evidence ecosystem, why we want to have systematic reviews, and the next bit of this talk is around the different types of evidence synthesis that there are. And I really actually want to get your thoughts around what are the different types of evidence synthesis that you're aware of. And if you're close to your phone, I think now is a nice time to pause and maybe check on the chat, Amir, if there are any questions. But I'd like you to quickly go to your phone and go to www.menti.com, and we're going to make a word cloud together. And put in the code there on the top of the screen there, 63357959. And let me know what are some of the different types of evidence synthesis that you're aware of. It'd be great to get some of those review types. We've spoken about them, a bit about them already. What are some of the reviews that you're aware of? Let me know on menti.com. It's anonymous, so don't worry, we won't know who's saying anything. You can give up to 4 responses, I think, so let me know. And just checking if there are any questions so far on the chat. I see we've got Nika, welcome, public health medical specialist, teaching medical students, fantastic. You've done scoping reviews previously. Fantastic. I see there's some colleagues from SAMRC. It's great to see. And Fatima from University of Venda, welcome. Need to do a systematic review for your PhD. Great. So I see we're getting some inputs already. So we're seeing there's a scoping review is one type of review. We have systematic reviews. I think the pink one is a rapid review. There's meta-analysis. Okay, that's fantastic to see. Lots of meta-analysis, narrative synthesis. Okay, all right. Strategic information. So meta-analysis coming through quite a bit. Those of you who haven't introduced yourself, please do so on the chat. So yeah, it looks like we've got rapid reviews. I think rapid reviews is quite an exciting one. It's an up and coming of, you know, in the last 2 years as a new type of review type that's getting a lot of limelight. We have a narrative synthesis, which I think is closer to, you know, qualitative evidence synthesis or qualitative review. Yeah, we've got a Cochrane corner. That's great. Yeah, so it's like a summary of a Cochrane review. I think a couple of those have been published in the SAMJ, the South African Medical Journal. Yeah. Okay. This is great. All right. So I see we haven't quite captured all of them, which I'm kind of happy about. It means that hopefully I can give you a good overview of all the other type of reviews that are out there, which there's so many, it's actually scary. And it's almost as if you can specialize in one type of review and spend your whole career just doing those. I'm sure Solange and Amit can talk more about that. So thanks for this input. I think this is great. You can carry on giving input into that word cloud as we go on. So there are many different type of systematic reviews out there. And I think a useful way to kind of stratify all of them, and this is not a complete comprehensive list here, is to think about some of the reviews that are answering different types of questions. And so we spoke about this a bit earlier in the slide, is that you get different kind of questions. You get intervention reviews, you get diagnostic test accuracy reviews. So for example, the first one here is a review of diagnostic test accuracy studies. So reviews that only look at cross-sectional studies that look at an index test versus a reference standard to diagnose a particular condition, right? Those are called DTA reviews, and they have their own methods and forms of analysis and everything. You also get, beyond the typical intervention reviews, you get prognostic reviews, and there are two major types of those, which I'll speak about later. But they're really reviews around, well, in a particular group of people who are exposed to something, what happens to them? What are their outcomes? So here we've got an example there around prognostic reviews. So they're really concerned about etiology, and what causes things to happen, or what are risk factors. Risk factor reviews is another way of putting it. We also get interesting reviews, which is called qualitative reviews, or QES, qualitative evidence synthesis. And they're really reviews that often are used to support traditional intervention reviews. So, for example, we might have a review around, the effectiveness of directly observed therapy for TB. But we also might have a qualitative review that's asking the question around, well, how acceptable and feasible is it to do directly observed therapy for tuberculosis? And those are reviews that focus on reviewing, synthesizing qualitative studies, so primary qualitative evidence. And this is a snapshot of, the three big type of reviews beyond a typical intervention review. And that's a useful way of looking at different type of reviews. Another way of looking at it is that kind of across the spectrum of reviews, you have reviews or evidence syntheses that have different purposes. And the first one there is a scoping review, which isn't a systematic review. It is a level below a systematic review, where the purpose of a scoping review, and I see many of you in the chat are doing scoping reviews, maybe as part of your PhD or as your introduction to evidence synthesis. And scoping reviews as its purpose isn't to synthesize and answer a clinical question like a systematic review does, which is typically, far more narrow and focused. A scoping review is just there to describe, the purpose is just there to describe, to just describe what is out there. And it typically goes through all the steps of a systematic review, but stops right before synthesis. So it would still have a relatively broad question, not as focused as a systematic review. It would still go through comprehensive search of the available evidence that best answers that question. It might go through a critical appraisal, but its purpose is really just to describe what is out there, to map what is out there, to tell us where the gaps are, and that might inform a systematic review in the future. And that's often what the scoping reviews aim to do. Typically, the scoping review, you look at primary studies, so observational trials and so forth, but you can also have scoping reviews of different type of study designs, right? Of guidelines, of qualitative studies, of whatever you want, really. So they're the kind of entry level. You also get your traditional systematic review, so that's just answering a specific clinical question. Those are the ones we're all familiar with. Typically summarizing, synthesizing primary studies. We also get reviews which purpose is kind of higher than a traditional systematic review. It's called an overview of a review, and that's also around answering a specific clinical question. But instead of summarizing primary studies, they synthesize, systematic reviews. And that's often to give us a bit of more larger helicopter picture of a particular area for a particular condition or question. We also have this new, in a sense, emerging type of review where it's a living systematic review. Again, it's also to answer a specific question, and it synthesizes primary studies, but it does so continuously. So the search is almost done on a weekly basis, or once a month. They update the search, and they're continuously building and feeding information and evidence into the systematic review in a living manner, in a live manner. And that, of course, takes a whole bunch of resources and time. And with the pandemic, we know that this is a type of review that has become very essential in how we deal with the infodemic, in that evidence is being generated so fast that traditional systematic review methods, which take 1 or 2 years, simply can't keep up with the evidence demand from policymakers and clinicians. We also then have the emergence of rapid systematic reviews, which is similar purpose to the others, except they are there to specifically answer a question, typically using synthesis of primary studies in an urgent manner, in a sense, within a couple of days or weeks, because the question is of utmost importance or within an emergency setting. So depending on what your purpose is, you might have to take a different approach to what kind of review you're looking at. Another way of looking at it is there are different methods of conducting any of those type of reviews we've mentioned before. And it also is quite dependent on what kind of question you're asking. If you're asking quite a broad question around what is the best available treatment for a particular intervention, a particular condition, like how do I treat depression? What's the best intervention, pharmacological intervention to treat depression? There are many different comparisons and drugs out there, and when it comes to answering that question, typically it's through a traditional systematic review, one can say, well, I would like to do it by looking at all the available interventions that are available in a network. And that's instead of doing pairwise or A versus B meta-analysis and comparing one drug to another, we compare all the available drugs to each other using this principle of direct and indirect evidence. Direct evidence being evidence of real trials that have occurred, and indirect evidence through kind of some mathematical problem solving, being able to give a treatment effect for when there isn't a head-to-head comparison by a real trial in a network. It's called network meta-analysis. Very, very nice. I think it's the future of systematic reviews, really, for big clinical questions. We also have other methods that drill down more to the kind of individual level, which is called individual patient data meta-analysis, IPD, where instead of looking at the aggregate level, so the unit of analysis isn't at a primary study level or at an aggregate level. It's not at a summary statistic level, it's now at a patient level, where we might say, okay, well, we're going to pool together all the data sets of trials and essentially do a very large primary analysis across data sets to come to particular conclusions. And that's done within a systematic review. So pooling a lot of data sets together across trials and analyzing it as if you're doing a primary study, or putting those all together. We also have then a third category that I think is worth mentioning here is method reviews or meta-epidemiological reviews. And these are essentially an amalgamation of primary study and a systematic review, where if you put those two methods together, you get a review of how to do research or review on conducting reviews. And that's typically around questions of what is the effect of excluding high risk of bias studies in a meta-analysis compared to including it? Or what is the effect of allocation concealment in trials? How much bias does it introduce, or does it reduce? And those type of questions. And they can range from the kind of studies you include, from anything from primary studies to reviews to guidelines to qualitative studies, depending on what you're asking. And it's all about how do we improve how we do research. And those are method reviews. So here I've put forward a table, and this is a very busy table, so my apologies, around kind of a comparative summary of the evidence synthesis research out there. Again, it's not comprehensive, but I think it's a useful picture of what's available. So in the columns, you've got all your different kind of reviews, evidence synthesis outputs, from scoping reviews, systematic reviews, DTAs, qualitative evidence synthesis, prognostic reviews, of which there's two kinds. You get your prognostic reviews that focus on prognostic factors, right? Identifying risk factors and prognostic factors. And you get what's called prognostic model reviews. So prognostic reviews on models of prognosis, right? So, so the unit of analysis there isn't risk factors, it's models of risk factors. And then you get overview reviews, you get living reviews, rapid reviews, and you get method reviews. And so I've kind of put forward what are some of what is the main focus of those reviews, what is their scope, and this is generalizations. Depending on what your question is, all of this will can change. But you can see, you know, a scoping review is typically quite broad in its scope. Systematic review, I think the scope can be quite dynamic depending on what kind of question you're asking. DTA kind of reviews are often quite narrow. They're focused to a particular test compared to another. So I find that to be quite narrow reviews. QES, qualitative reviews, are quite complementary. So they often are there to complement existing information around interventions of effect, around how people, if they're feasible, equitable, acceptable, and so forth. So they're complementary, I feel, to existing decision-making in traditional reviews, and so on and so forth, where you'll see for each type of review, the kind of typical PICO elements that might be involved would differ. So for example, in a scoping review, you might only need to specify the population and the outcome. But for a typical systematic review, you'd have the PICO, the population, intervention, comparison, outcome. But for, you know, qualitative, you'd use a totally different formula. You'd use SPICE or SPIDER. For DTA, you'd use the population, the index, the reference standard, the outcome, and it'll differ. The unit of analysis, I think, in this is also interesting, where typically in all of these reviews, you'd have primary and secondary. You'd have primary research that you're looking at, and in brackets, I put kind of the typical unit of analysis that you'll be looking at. So the thing that you're collecting. So for a systematic review, you're typically, you know, if it's an intervention review, you're looking at trials and so forth. But if you're doing DTAs, you're only looking at DTA primary evidence, or qual review, you're looking at primary evidence, but it's qualitative. Prognostic reviews, you're not looking at trials most of the time, you're looking at observational research. Or prognostic model reviews, you're looking at prediction models. I also give a summary there of the critical appraisal tools, the typical ones we use, the main ones we use. There's also, I think, you know, for each of these, there's many different ways you can synthesize the evidence. So systematic reviews can, you know, it's pairwise meta-analysis, IPD, network meta-analysis that you can go for. DTAs are very complex, you know, that range from linear regression to bivariate regression to hierarchical ROC analysis. Qualitative evidence synthesis, you know, there was a lot of comments around, you know, meta-aggregation and meta-synthesis. And so there are many ways you can synthesize those. Prognostic reviews, you have typical meta-analysis, where you have meta-regressions. And the list goes on, right? I also provide a bit of a timeline here. So typically, you know, a scoping review can take quite short. A systematic review, you know, it can take up to years to do. But interestingly enough, most of these reviews take years to do. But typically, rapid systematic reviews would take days to do, as opposed to years or months to days. Some of them have grade, you know, is embedded in the process. Some of them are missing. So prognostic model reviews, I'm not familiar with a grading process for prognostic model reviews. The evidence to decision framework, whether it's available. So once we move from a synthesis to a decision, that can vary. This is my opinion on cost implications. You know, what kind of support do we need? What kind of expertise do you need? So this is all my judgments, and I would love to get input on this. And of course, what reporting checklists are for each kind of review. So I found this to be useful. I see some questions, and I'd love to get to those in a bit. I'll get to them quickly. Importantly, I want to quickly just say is that we have traditional literature reviews, and these are kind of qualitative narrative summaries of the evidence on a topic. So these are like opinion pieces, and they're typically written by the expert, like by invitation, and typically involves informal, non-transparent, and subjective methods of how they've collected the evidence and interpreted. And they're very useful to give a new entrant kind of an understanding of what's around in a topic. But we need to be careful about distinguishing between what a systematic review is and a narrative review or a traditional literature review. And I think there's a lot of confusion about these two areas and a lot of gray that one needs to be considerate of. Yeah, there are many advantages to doing systematic reviews. They provide you with a complete and reliable picture of the available evidence than any single study can. It saves time. It can resolve inconsistencies from single studies. It's through meta-analysis. It can provide far more evidence and power to an answer that individual studies just simply wouldn't be able to do. It can explore differences between studies and answer questions through subgroups. And it can establish, it can resolve whether we need to do further research or not. There are, however, some big limitations to doing systematic reviews. They can really kind of be considered final and conclusive. In rare circumstances, you'd have reviews that say this is the ultimate answer, and we no longer need to do any further research on a topic. It has happened before, but they're often not considered the final and conclusive answer, but they are definitely considered the best answer to a particular question, any design, to the best design to answer any particular question. And again, they are dependent on the availability and the quality of the studies that are contained within. So garbage in, garbage out. And again, there's a lot of conversation to be had around including equity in systematic reviews and equity considerations in how we do systematic reviews. And speaking to this also is that systematic reviews often assess the effect of interventions more so than, for example, an analysis of adverse events of drugs and so forth, although those are often included in the outcomes. And importantly, the last one I want to say is that systematic reviews are not there to make recommendations, and they are not they're not there to be used as they're not there to replace clinical practice guidelines. They are there to inform how the evidence-based in making clinical decisions. They inform clinical practice guideline development. The evidence underpinning a clinical practice guideline. I saw in the word cloud that there was meta-analysis as a term, as a type of evidence synthesis. And I think it's worth clarifying that a systematic review is not the same as a meta-analysis. A meta-analysis is simply a statistical procedure that combines and pools two or more studies together using a weighted system, right? It's like a t-test or a chi-square test in a primary study. It isn't a study design in itself. So a systematic review, if appropriate, can use meta-analysis to answer a particular question. If it's appropriate through this kind of pooled mechanism, or it can do it without meta-analysis. A systematic review with a meta-analysis isn't any less valid than a systematic review without it. And one shouldn't say that a systematic review is the same as a meta-analysis. It's like saying that the t-test is the same as a cohort study. You're making a categorical mistake, like a term mistake. And there are many resources around how to read a systematic review and meta-analysis. One of the last slides is, again, there are many steps in doing a systematic review. It starts with assembling the team, defining your question, considering the logistics, the funding, registering your title, so making sure that people are aware that you are doing this review and making sure that others haven't already done it, planning your review methods, publishing your protocol, planning for it, then doing the review, and eventually also dedicating to updating it. It's important to note that it has to be systematic and transparent, and that's a hallmark figure of it, the hallmark characteristic. Systematic reviews tie into the process of guideline development, in that this is a typical kind of steps of a guideline development process, where a systematic review, steps 3 to 4 and 5 is quite key in that. And eventually the results of a systematic review is presented in a logical manner through what's called a summary of findings table, an evidence table. And that's then presented to a committee of experts who transparently go through a process of using that evidence to make a recommendation. And they include other important public health considerations, like, is this beyond just what is the intervention effective or not, but is it feasible, acceptable? What is the cost of this intervention? What is the certainty of the evidence, and so forth? And eventually that then becomes a recommendation. And I'm just looking at my time, so I'm going a little bit faster here, is when it comes to making a decision about, well, I want to start doing a systematic review or scoping review or prognostic review, whatever the case may be, I think there's some key resources key decisions you need to make before starting on such an endeavor. One is make sure you have a clear question. Make sure you've got a clear idea of what you're asking, what review you want to do. And then, as a key principle, as we've seen in COVID, is to try and avoid duplication of effort. First, have a look at Prospero and the Cochrane library around, is there an existing systematic review out there, or someone planning an existing systematic review that's already answering the question? Because we need to avoid duplication of effort and avoid research waste. So first, try and find and appraise an existing review for currency, credibility, and comprehensiveness. So in other words, use the AmStar2 tool to critically appraise a review for internal validity. Check whether it's up to date and whether it answers your question. If it does, you don't need to conduct a new review. You can just simply use that one. If it's out of date, you can consider updating it or replicating it, depending. Or if there's nothing, if there's no available review, then you can only consider doing a new review. And this resource from COVID-End, which is a group of evidence synthesis leaders and centers from around the world, more than 50 of them, have come together to kind of produce this resource you see on the screen now, and you can access it via COVID-End, just Google it. Prof. Young was part of that process and others. And there's also a linked one regarding guidelines that I think is really useful. And then lastly, of course, well, linked to this resource, there's a PDF that gives you fantastic resources around conducting, appraising, finding, using systematic reviews that I think it is very useful for new and experienced authors in systematic reviews. And of course, the Cochrane Handbook is essential when we're talking about the resource. Lastly, so what happened to Johanna in the end? So her mommy went off to find a systematic review, and we found one in the Cochrane Library that specifically spoke around antibiotics for acute otitis media in children. And we started off with giving her, and we read it, and we read the plain language summary. And in the end, we actually decided to give her antibiotics because she had bilateral ear infection, which is kind of advised in this case. Otherwise, you'd kind of be cautious of giving antibiotics, apparently. And she recovered and she was happy. But we were glad that we were able to access such a review. It was up to date, and we're fairly confident that that it worked. And we kind of completed the evidence cycle, which is really exciting. Last thing I want to quickly just say before I end it off and hand over to me for questions is, it is the World Evidence-Based Healthcare Day and week this week. And there are many conversations happening on Twitter, online, specifically around the pandemic. And so I would want to invite everyone to also just join those conversations. Follow us on Twitter. There'll be lots of conversations happening today. And of course, if you're interested in finding, using, appraising, and interpreting systematic reviews of effect, please do contact Amir and myself. We have a course, short course, online 6-week course called the Primer in Systematic Reviews that might be very useful for you to have a look at. And of course, we run a 12-credit module called Systematic Reviews and Meta-Analysis that I'd also want to invite people to have a look at. So what about the clinical judgment component for JoJo, Nika? So yeah, we decided to give her antibiotics because she had bilateral ear infection, and in the end she did recover. I hope you can ask me a bit more about what do you mean by the clinical judgment. It was informed by the evidence, and then my wife kind of intervened. Yeah. So I'm going to hand over to Amir. I see there's some questions, and welcome questions of anything on the slides that we've had a chat about. Thanks, Amir.
Thanks, Michael. So I see that there were 3 questions by Guy earlier. And so the one is asking, he's wondering for a simple definition to give as an evidence. He says, I understand what it is, but can't say it in words or with words. I think it's a few chats up.
Yeah, I'm wondering what simple definition you give to an evidence. Guy, can you expand on that? I think the key thing is there, if I understand you correctly, is that when we make a public health decision, we should use the best available evidence, and what that evidence is dependent on what the question is. And that's quite a broad topic, but yeah, please go ahead and let me know if there's anything else on that.
I think while we wait for Guy to respond, there was another one. Is it ethical to do a systematic review? If another one has been done on the topic already.
Yeah, I mean, and that's a question that we're dealing with currently in the pandemic. Is there are many systematic reviews and guidelines being produced on the same topic, and that's just it speaks to research waste, which in a sense you can consider to be unethical, because resources then should actually be channeled in a totally different direction for things that we don't have answers for, that we haven't already produced evidence for. So
Sorry?
I would say that it is unethical to do research, a systematic review, if there's already high quality, relevant, and up-to-date review on the topic. I think you're contributing to research waste in that sense. And in that sense, I think it would be unethical, yes. And I see another question. When considering the types of evidence as scoping review, traditional review, or other reviews, is it right to consider traditional systems as the most common and suitable source of evidence for daily clinical practice? So I guess it depends on, if you're in regular clinical practice, I would say yes. In daily clinical practice, the thing that you're most likely going to be basing your decisions on is a clinical practice guideline, which should base its underlying evidence on high quality, relevant, and up-to-date systematic reviews. So that's typically what people would look at, is a guideline. But yes, the things that inform decisions would typically be considered the intervention review or the traditional systematic review for daily clinical practice. Yeah.
Yeah, I don't see any other questions that have come through. And we are on the hour at the moment.
Yeah, I see Nika, yes, absolutely. The point around we advise to consult an objective, independent clinician, not treat our family and friends. Absolutely, you're spot on there. Yeah. Yeah. So Nika, we didn't go to an independent clinician, and I think that is part of the trouble as parents who are, where one of them is medically trained. They tend to make their own decisions, which might not be the best. At least we used a review to inform part of it. Hey, Nika.
Yeah. So I see Guy saying thank you for the answers. Michael, do you have any closing remarks or?
Amir, no, just to say thank you so much, and I hope people have found this useful, and just would like to encourage everyone to take part in the World Evidence-Based Healthcare Day. Please visit their website, and thanks Amir and Cochrane for inviting me to speak. Really appreciate it.
That's great having you, Michael. Always a pleasure. Very informative discussions and presentation that you gave. So again, really thank you for covering this topic today. And I guess so. Again, before we leave, thank you to everyone that joined today. Please see the link that I just added to the chat. Again, just reiterating that that's the link to the webinar evaluation form, and we always appreciate your feedback for tips and ideas or so on how to improve things going forward. Yeah, so we hope to see you at the next webinars. Look out for our emails and advertisements that are coming through. And so look out for some of the courses that Michael hosts or runs at Stellenbosch University, like the online primer that will be running next year again, and various others. So I bid you all a good afternoon further, and we'll see you next time. Thank you, everyone. Thank you, Michael, as well.
Thank you, Amir. Thank you.